Hello friends, it's Carla, your online doctor with today's Live in 5. Today is Tuesday, December 15th at 5 p.m. Okay, so it's been over a month since President-elect Biden announced the members of his coronavirus advisory board, or his coronavirus task force. Included were top infectious disease and public health experts. Unfortunately, missing from the list were mental health professionals. Now, studies continue to show patients with COVID-19 presenting with or following the infection, they develop neuropsychiatric symptoms, including delirium and anxiety. Now, one study suggested in the short term, close to 25% of patients experienced confusion, and in the long term, many reported emotional lability, impaired concentration, and more. So more recent studies are showing the rates of dementia and insomnia are much higher in COVID-19 survivors. But if nothing else, this pandemic has been associated with significantly increased rates of anxiety and depression for a multitude of reasons, okay? Understandably so, but across the board, mental health issues are being experienced by COVID patients, survivors, and many, many people. Now, I believe personally it's very short-sighted and irresponsible not to take seriously the long-term consequences of the damage to the American people's psyche, as well as others around the world, of course. In the United States alone, besides the obvious, the virus itself, we know, we've suffered as a community, as a country, we've suffered racial unrest, economic uncertainty, job loss, business closures, children out of school, to name just a few of the upheavals that have been happening. The stress itself can be overwhelming to many people. Now, psychiatric disorders are notoriously difficult to diagnose and treat, which is why mental health professionals will need to be included in the post-pandemic treatment model and should be represented on this COVID task force. Okay, it just is a must. The mental health system we have now in place is already inadequate for those currently diagnosed with mental health disorders. Okay, so problems with insurance coverage, shortage of mental health providers, and shortage of inpatient facilities are just some of the issues that we currently experience, not to mention decreases in federal and state funding for much needed outpatient programs. Okay, since the pandemic, rates of anxiety and depression have increased in the face of reduced services due to layoffs. This is not a good combination. Okay, research has also shown that chronic stress can disturb not only our cardiovascular health, but our immune health, which of course then affect everything together. And then of course we know it affects our mental health. So chronic stress is very dangerous. So if we don't start to address these issues on a national level, we are definitely going to suffer traumatic effects in the years to come. Whether you want to call it a post-traumatic mental health issues, or just, COVID itself can be affecting the brain. So there are so many areas that need to be addressed. A mental health professional needs to be, not one, but many, need to be included in the coronavirus task force or advisory board that the new administration is putting together currently. So keep your eyes open, see what, if I get more information or ways that we can address this in terms of, contacting our congressman or whatever to get the word out. I mean, it should be obvious, but, maybe we need to make it a bigger stand that, that this really needs to be addressed, because people are suffering in so many levels that this should not be left unaddressed, for lack of a better word. So on that note, I hope you guys are having an awesome day, and I will see you next Thursday, this coming Thursday, for another Live in 5.